Hey, everybody. Really important and fascinating chat today with an industry expert and innovator in healthcare cybersecurity. Ed, how are you?
Good morning, Evan. How are you, sir?
I'm doing well. We're both in Massachusetts, so I guess we'll call this a special Boston area edition.
I love it.
Thanks for joining. Really intrigued by your background, bio, and mission at Censinet.
Mhm.
Before that, maybe introduce yourself and a little bit about your personal and professional journey.
Yeah, sure. I'm Ed Gaudet. I'm the CEO and founder of a company called Censinet. We're based in Boston, and we focus on third-party and enterprise risk management for healthcare. We focus exclusively on healthcare. This is will be my 11th company. I've done software all my career, in different industries, and different types of software. Different a myriad of problems through solved through software automation. Yeah, no, I'm excited to be here.
Excited to have you. And so let's go back. What sparked the idea for Censinet? What was that moment in that long
Yeah,
journey that said we need to fix this here?
yeah. Well, I love to tell the story that I was retired briefly, and my wife had other plans. She cordially commanded me to go back to work because I was causing too much trouble and following these guys around again. So she thought I was acting like an 18-year-old when I should have been getting out of the house and working. So I went back and looked at a couple of things that were always problems that I saw. One of those was this process of managing, facilitating, marshaling security risk assessments within the context of a vendor organization. So at my last company, we were a healthcare provider of authentication and collaboration tools, and we would we'd get uh, you know 5, 10, 20 of these things a week, and they were all different. So if you saw one risk assessment request, you saw one, and you had to respond to it as if it was new. And I always thought about if there was a way to get leverage out of the process. We tried it internally. We tried to build a knowledge base. We tried to hire people, but again, it was really difficult to manage it at scale. And so, from the vendor's side of the problem, I sort of understood that pretty well. And then I reached out to a dozen or so providers, health systems, hospitals that I'd worked with in the past and said, "Hey, do you have the same problem? What's your problem look like? Let's map it out." And started to notice there were patterns. And then, quite frankly, took a look at what was out there already. So what was the state of the art? Most of those were certificate-based solutions where
Mm.
someone hired a third party to assess risk, and it was a point in time delivery of a certificate, which you really had to understand what was audited, what was reviewed, and there was really lack of transparency, and it didn't any of the solutions that were out there at the time, 2017, didn't really approach the problem as a life cycle problem, right? They looked at it as a one and done assessment, but what was happening was the world of technology and the world of applications was changing. Everyone was moving to the cloud, and so this notion of on-prem applications that might change twice, three times a year was going away because cloud systems can be changed, daily, right? And so this notion of risk really had to be looked at across the life cycle of that relationship with the vendor and the product, not just out of the box risk, but also how it was used internally within the organization. So it's a multi-dimensional problem that required a new approach to dealing with it.
Yeah, fascinating stuff. And you bring a unique platform to the core of what you do, Risk Ops. So maybe describe the platform,
Yeah,
its benefits, and how
yeah.
does it work?
Yeah, so again, going back to that word leverage, right? The idea around
Mm.
leverage. I took a page out of the Amazon playbook, looked at a marketplace architecture, what we call a two-sided network, and thought that was the unique differentiator from a technology perspective, from an innovation perspective, that we could apply. Now, if you've never done a two-sided network, which I had never done at the time, really hard. Um,
Mm.
Building out a two-sided network is really difficult, not just from a technology perspective. That's actually the easy part. The hard part is really the business model, the economics, the value conversation that you have with both sides of the network. Which side do you monetize initially? Because you can't monetize both sides. It's really difficult to do that. Typically, you have to subsidize one side as you're building the network over time. So, today we've got a couple hundred providers on one side of the network, which is the side we monetize. And then we have about, I think it's like over 44,000 vendors and products on the other side of the network. And so the value that providers get is they get this digital catalog of assessed vendors that from a vendor perspective, they just push a button and they can send all of the relevant information, responses to questionnaires, the questionnaires that matter to them. So we curate all of that content internally, which again, if you use a pipeline-based application, you've got to curate all that content, and which is a mess and really hard to do over time. So we leverage the intelligence of the network to make sure that we're asking the right relevant questions. We're doing it in a way that is easy to understand. We're doing it in a way that's contemporary. So when AI came out, we were able to quickly add AI level questions to all the products and services, and the network benefits because of that leverage we get. Right, I don't have to go to each vendor, each customer, and the customer then has to upgrade to that version of the software. Right, it's all on the network. Right, so that curation piece is another part of the value, and when you have a two-sided network, it really drives the value of that substantially because everybody gets those changes, and you can learn from the wisdom of that network, the wisdom of the community, and curate the things that matter over time.
Wow, impressive. That's extraordinary. So we both read the headlines, the news headlines every day, and it's
Yeah.
pretty horrific when it comes to healthcare cyber challenges. But from your insider perspective, what are some of the biggest challenges, headaches that for healthcare orgs that you see day in, day out?
Yeah. So, prior to 2016, we didn't really have to deal with ransomware.
Mm.
And now ransomware, obviously is a risk that threatens every organization, regardless of industry, regardless of size, et cetera. And so this notion of why are the bad actors good at this? What changes did they make over time? And what's fascinating is if you really look at it, they distributed the work in terms of microservices, right? So a
Mm.
group of people, they're the people that collect the cash. Another group is the people that create the tech that does the bad things on the networks and the systems, right? And so another one steals and looks at credentials, right? And so there's
Wow.
there's this concept of organized crime, if you will, that's now digitized, right? And so think about organized crime and the way that used to operate. The bad actors have applied the same principles to managing ransomware. And so we have to think differently as a community. We have to think differently as an industry, and we have to think about those that points of leverage and ways to organize, if you will, to manage those threats, to manage those attacks over time. It's no longer sufficient for us to do it independent of our community, our peers, our industry. So we've got to think differently. And we need technology that enables that, right? So Censinet is one option for that, but there's other options that one can use for different applications of security programs, et cetera. So we think, like, for example, we not only provide third-party risk, which is where we started. Our customers also identified other aspects of risk management that they were managing in different silos within the organizationally, but also from a technology perspective. We basically began to identify those, and because we're focused exclusively on healthcare, we consolidated those on the platform when we built out a whole nother side of the network we called enterprise risk. And that's where providers are looking at themselves, their profile, their systems, their controls, their threats, their resources, effectively, their overall cybersecurity program, and they're managing those gaps over time and closing those gaps to be obviously more secure. The nice thing is when you have a two-sided network, you can actually extend it and you can become multi-sided. And so we've taken that same principle in the provider vendor scenario and we've applied it to provider. And so now when you're doing your enterprise risk management, you're not doing it in a vacuum. You're looking at it from the context of what your peers are doing. So we have this benchmarking service that we provide with all the data that they use, where they can see now, where do I sit relative to my peers, and I can dial down to a really distinct cohort of peers that look more like me. I can also see what I'm doing across the network, and then I can identify my gaps, and I can look at them within the context of my peers, and I can have meaningful conversations with my leadership team, with my board, about resources, about investments, et cetera. Right. So it's a new way to think about your cybersecurity program, which, again, a decade ago, everybody was sort of doing it in a vacuum. They may have been sharing practices at conferences. They may have had, smaller peer groups. This is a way to leverage the power of the network to really extend that. We have 140 people signed up for this current benchmarking wave, which will release during the Vive and the HIMSS timeframe next year. So, the more people that come onto the platform and do benchmarking, the more relevant information they get that's available to really understand where they are, and then over time drive and close those gaps in their overall program effectively.
Oh, what a great focus on positive collaboration. And so when it comes to this collaborative risk network, um, how do you think it can be scaled? What's the key here to getting participation? And is it just getting the word out? And what does it look like over time?
Yeah, Evan, you broke up a little bit there. I'm not sure what happened.
Yeah. So when it comes to this collaboration network, how does that look over time? Do you envision thousands of companies participating in the risk network?
Yeah, no, it's a great question. So if you think about healthcare, and again, this is the challenge, right? One of the learnings, from experience is, I think everyone thinks they know healthcare. Everyone,
Mhm.
everyone from a technology perspective, you have horizontal technologies, and then what ends up happening is they add these slices of vertical programs internally within the organization. They say, oh, we have a finance vertical, and we have a healthcare vertical, right? And those are all good and well, and at some level they're necessary, but I find by going all in healthcare, you really understand healthcare at a level that you didn't when you were trying to manage multiple industries.
Mm,
And the first thing you understand is healthcare is different. It truly is different in
sure.
terms of how the business operates, what matters to the business, how the personas within the context of the business, the consumers of technology, the doctors, the nurses, the clinicians, how they work and how they leverage technology, very different than, say, an accounting group, an accounting firm, or a bank, right? And so understanding those workflows at a level that you can apply the automation, the technology to drive real value is unique in a healthcare context. The other thing you learn is that healthcare as an industry is big. And so it's 18-20% of GDP in the US. And it has multiple subsegments, right? You've got your hospitals, you get your health systems, you have your rural communities, you have your physician practices, you have your post-acute ambulatory practices, right? You have your long-term care, you have your skilled nursing facilities, you have your pharmaceutical organizations, you have payers, right? And then everyone in between. And each one of those subsegments requires a different view of what's valuable to them in the context of their workflows and how they can really drive value, especially in the context of a network, right? And so that's again, from our perspective, being purpose built for healthcare means that we're not delivering a blank canvas like most solutions, where they're saying, we've got this unbelievable flexibility that you can apply, which again sounds good until you try to apply it. And there's two issues with that, right? Number one is, if it's too customizable, then it takes time to get it right. Right. And so we times will hear from customers that have tried to implement other solutions. They call us in 9 months and they go, well, you know what? We still haven't gotten it deployed. And the reason is because most organizations look at their existing process and they try to apply it to the technology. And if you have a great process and a bad solution, you're going to get bad outcomes. And conversely, if you have a bad process and a great technology, you're going to get bad outcomes. And so you have to let the technology and let the process inform one another in a way that drives transformation, right? Truly transforms how you're doing things. Because if you were doing things correctly, you wouldn't need technology, right? You need technology because you see an opportunity to drive efficiencies, maybe get better data, maybe provide better outcomes, right? And so you have to think about it in the context of what you're doing. Are you set up for success in your current process, or do you have to look at it a little differently? Do you have to let that process, you know, inform the technology, but also let the technology inform the process? Does that make sense?
It does. That's
Yeah.
amazing insight. So everyone's talking about AI inside healthcare and outside.
Yeah.
How do you see it streamlining or kind of supercharging risk management in healthcare? What are your thoughts
Yeah.
there at this
Yeah.
early stage?
Yeah. So one of the other innovations we drove early on was this notion of risk ops. And risk ops, again, took it out of a page of this notion of DevOps and SecOps coming together, right? So it's always about these processes we do, they're manual, we want to automate them, we want to save time, we want to increase our output, et cetera. And so the idea around behind risk ops was taking the traditional notion of risk management. So if you look at it from a GRC, a governance, risk, and compliance world, mostly that is about documenting. It's about understanding and documenting your overall risks in a way that you can use that information for making decisions, right? So having some type of decision support system, whether it's on paper or in a portal, right? Or in a reporting system, data analytics, whatever,
Mm,
right? But what we found that was missing was that connection with operations, right? If I understand there's a risk, actually what I want to be able to do is understand whether or not I want to accept it. I want to dispose the risk in some way. But ultimately, I either want to accept it and be okay with that, or I want to reduce it or eliminate it in some way. Right. And so this connection with operations was sort of a big aha for us, that if we could do that in a way that was meaningful, we could not only drive efficiencies, right, from a collaboration perspective, but we could also drive out risk. We could take risk out of healthcare, which was the initial vision for the company. How could we take risk out of healthcare? And so that connection with operations really defined this notion of risk ops. And so when you think about AI, you think about it in a couple of contexts, right? One is around RPA. Can you actually drive automation efficiencies through the application of AI? The other is around analytics, predictive analytics. What intelligence, what insight can we discover that we didn't know, but now we have this ability to look at it in a meaningful way at scale, right? What would we be doing differently from an operations perspective? So we see the application in two ways. We also know that within healthcare, security is paramount. Like, you can't, especially as it relates to cybersecurity, you cannot just deploy AI into your product and not give customers the option to
mm,
understand what you've deployed, right? So transparency and visibility into that, right? And also the ability to toggle it on and toggle it off. So when ChatGPT came out, first of all, I was like, holy cow, this is bigger than the internet. This will be bigger. This is going to completely change the way we do things, not only from a software development perspective, just from an operations perspective, et cetera. And so, but we also knew that in healthcare, you have to be sensitive and you have to be vigilant about protecting patient safety, protecting patient data, and really making sure that you're not introducing additional threats into the environment. So even though there's a lot of excitement early on, we also knew that healthcare would sort of govern, if you will, the application and the introduction and the adoption of AI. And that's sort of what's happened, right? So the early use cases within healthcare are things like ambient listening, where you
mm,
take a known process where a doctor is having a consult with a patient and wants to be able to leverage the documentation process, the notes process, right, the summary process within the EHR, and do it in a way that's effective. So ambient listening allows the doctor to focus on the patient, focus on the conversation, the actual the scheduled meeting with the patient, right? And then also do it in a way that's focused, but also that's also has a level of accuracy that captures the conversation and puts it into the record of that patient, right? So that's a really interesting use case, and Epic does a really good job. Epic is the EHR that most organizations use today, and others as well. Cerner, like they're all kind of driving towards this ambient listening documentation use case, which is the right way to start off, I think, in healthcare. But there's a number of other use cases that people are in varying stages of understanding, discovering, applying, adopting, etc. So we'll see next year a lot of additional use cases come out, I think, in healthcare. But from my perspective, there was a big push to understand AI. We certainly jumped on it early on. We used ChatGPT Open API in the context of prototyping some
Mm.
early ideas with the relevant boundaries and disclaimers, right, for one side of the network. But we quickly realized we had to build our own infrastructure. So we're working with Amazon. We have Bedrock, we have the Claude models, and that's all self-contained within our secure environment and our infrastructure. So we believe that those publicly available models are interesting and can be useful on a prototype level, but for scale, and certainly in healthcare, you need a very secure environment. It's got to be part of your overall strategy long term.
Got it. Makes sense. And speaking of security and regulations and compliance, I mean, this is an intense landscape getting more complicated over time with new regulations. How do you keep up with these ever-changing requirements, and how do you think about those in a, cybersecurity context?
Yeah. One of my customers early on, suggested I get involved in a public-private partnership that existed within government, and so I jumped on a couple of these working groups and task groups. The first one was the HHS 405D,
Hmm.
which developed a framework, a set of best practices, if you will, for cyber hygiene called the Health Industry Cybersecurity Practices (HICAP). It's formerly known as it's known as now. That's going to
Hmm.
evolve over time. There's a lot going on at the administrative level now with the new administration, and legally, there's some movement to create the equivalent of a meaningful use standard. Meaningful use was about driving the adoption of electronic health records back in 2009, 2010. Similarly, they're looking at what I call a notion of meaningful protection. Like, what's the
Mm.
level of standard? What's the level of care that an organization needs to protect patient safety, and legislating that in a way where you can enforce that minimum standard of cybersecurity controls and practices and procedures and processes, et cetera. And so we have HIPAA that's been around for a while. And so given where things are today, it makes sense to extend HIPAA to cover new technologies, new approaches, and new considerations as it relates to cybersecurity. So by being involved in these working groups and task groups that are developing these new frameworks, these new models, it really helps us stay up to date with what's coming and be able to react quickly. So an example of this was HHS created this notion of cybersecurity performance goals
Mm.
with collaborating with CISA. And these performance goals basically, again, create this notion of an essential set of best practices or standards, minimum standards for cybersecurity, and an enhanced level of standards and best practices. And that was in play, was announced at the end of 2023. And we were on top of that. From a product perspective, we added in the CPGs into our overall platform and our product that could be applied to the benchmarking that we talked about earlier as well in the beginning of this year. So by staying and working on those task groups and actually helping author those publications and providing data to help drive those standards. We stay up to date with what's coming down, and we take a little bit of risk of putting it in the platform and making it available to customers and seeing what they're going to do quickly with it. And we're seeing an uptake on the CPGs but we think the CPGs, the cybersecurity performance goals, are going to be subsumed by HIPAA because it's already it's a law. It's got teeth.
Mm.
You can drive enforcement. There needs to be consideration for those organizations that are struggling financially, like the rural community hospitals. So if you're going to regulate more, requirements around cybersecurity, you've got to make sure that those folks can actually support it financially.
Interesting. So when it comes to your clients, I mean, notoriously private when it comes to talking about the work they do, but care to call out any of your clients? Maybe pick a favorite child in terms of what they're doing, who they are, and how you're working with them?
Well, I have 3 daughters. I've learned not to have a favorite. So,
Okay.
so I don't have necessarily a favorite customer, but I will say the relationships we have with customers, it's one of the things I'm most proud of. We spend a lot of time, probably more time than most. I mean, certainly in my experience, we've created this customer program that I think will rival any organization. And
Mm.
really, there's this adage that people would say in the product world, customers don't know what they want. And I disagree with that. Customers know what they want. You need to ask the right questions to
Mm.
understand what they want, right? And so that means you need to spend more time with customers. You need to develop relationships with customers. And when they get comfortable with you and develop that trust, they will make more options, more opportunities available to you over time. And so, like, for example, I'll bring out, I mean, and this is all publicly available on our website too.
Okay.
So I won't mention a customer that's not, but Intermountain was an early adopter of our
Mm.
technology. We worked with them early on, and they really helped shape the platform. And in a couple of different ways, they drove us to to deliver on our commitments for things like efficiency. You said you were going to help us drive this process from this amount of time down to this amount of time. We're going to hold you accountable to that. And I love
Mm.
that. I love when customers will do that. Some customers will do that initially, and then because for whatever reason there's a misstep in the process early on with onboarding or whatever, they tend to disengage, and that's the worst scenario, right? We have so many opportunities for our customers to tell us when we're great and when we're not so great. And I want to hear the things when we're not so great, because I mean, I know where where we're driving value. I want to know where we're not driving value for customers, because if I don't know, I can't help fix it, right? And I think those are the things that we're at a point now with customers where many of our customers are comfortable telling us where we need to fix things, or where we need to evolve the platform over time. And that's what I love most about the relationships, is they do know what they want. And if you let them tell you, then they'll take you to places that you hadn't expected early on when you started the company. And I'll give you another example. So in the Intermountain case, they had this silo of risk around research,
Mm.
IRB, and institutional review board process that and basically it involves the health system, an academic medical center, and typically a pharmaceutical company. And they're doing trials, right? They're doing clinical trials and research. And the health system provides data to the academic medical center and the pharmaceutical company as part of that IRB research. And the patient safety is well understood. The process of understanding patient safety from a clinical perspective and managing that in that process was well understood, but the data safety was not. And so we helped them really define this workflow where we could help drive the risk, understanding the risk of the data aspect of that workflow, as an example. And that's a widely used part of our application at Intermountain today. So so
Wow.
it's relationships like that are really critical. We met with I did a customer. We have this webinar series called Censinet Champions, and basically we interview customers, like, what did the world look like before Censinet? what were some of the problems you had you were trying to solve? Why did you pick Censinet? What's the value you get? So it's a pretty standard case study like format, but we do it, through video. And before we got on the call with this customer at State and Children's, they said, "Hey, we wanted to talk to your product team because we had some ideas." And so we got the head of products on the call before we did this Champions webinar. And it was great because they were like, "Hey, we have this problem," and the product guy was like, "Oh, we're fixing it, and let me show you what we're doing." And it was great. And I'm like, "You know what? Talk about that on the webinar." And they're like, "Really? You want us to bring up the issue?" I'm like, "Yeah, bring up the issue, talk about it," because it also highlights to those customers that are thinking about working with us. You're basically telling them we're not perfect, but we're willing to partner with you in a way that's meaningful. And I think that's sometimes more important than actually the initial technology that drives the initial relationship, right? I always tell customers, you've got so many options where you can spend your time, your resources, and your dollars, your budget, and none of those are perfect. And so really what you should be asking is, which organization is going to partner with me in a way that's going to help me through those issues? As those issues come up, which partner is in a position to help me work through those issues? Isn't going to nickel and dime me on a contract perspective, isn't going to love me, then go away after the deal's signed, right? Which organization is set up in that way to understand my problems and then help me in ways that, aren't product related? Maybe it's the community that we manage. Are they going to make introductions to peers of mine where I can actually explore other things that may be adjacent to what this product does, right? And so I have a customer advisory board that I meet 3 times a year with my customers. And the first hour is basically me facilitating them sharing their priorities, challenges, and it's not Censinet related. And I love that because we get a view of what customers care about outside of our world. And so we could look at opportunities maybe to help them. But more importantly, they're sharing these challenges with other peers and they're getting other ideas. And they're going, "Oh, wow, I hadn't thought about that. Let me go back. Hey, can I call you afterwards?" And so this connection, this community, again, this whole notion of leverage, right? We do it within the product context, but we also do it within those relationships and community perspective because we think it adds additional value that, again, no one really talks about initially, but when you become a customer, you see that, right? And so I think from my perspective, if I'm talking to an early prospect, I always try to, ask the customer, ask the potential, vendor that you're going to work with, how do they deal with issues? When issues come up, how are you going to deal with the issue? What does that look like? And because I think that you're going to have issues, like nothing is perfect, right? So you want a partner that's going to actually understand that and work through those issues with you over time.
Well, great notion there. And when it comes to your podcast, how can people find it? What's it called?
Yeah, so the marketing folks asked me to start a podcast a year ago, and we have over, I think, 110 or so
Great.
episodes already. And basically, what I found there was a gap in the market where most podcasts were technical in nature, and I really wanted to understand the person and really understand what the person was behind the role. And so it's really all about, we asked some initial questions about, their organization and their priorities, but I quickly get to like, if you could go back in time and tell your 20-year-old self something, what would it be? What's your favorite, musical, your favorite band with favorite music? If you were on a desert island, what top 5 movies would you bring with you? Right. So questions that are like personal, but I think that's what's interesting to me is the person behind the role, right? And really understanding that person. So that's what we focus on. It's called the Risk Never Sleeps podcast.
Oh, great title.
It's available. Yeah, it's available on Spotify and Apple and other networks. And
I'll check it out.
we do video and audio as well, like you.
That's the way to go these
Yeah,
days. Absolutely.
yeah, absolutely.
What are you looking forward to in the busy run up to the year end? I'm guessing there aren't many Grateful Dead concerts left this year, but what else is on your agenda
I
before?
I did go to the Sphere in June with my
I
daughters
imagine you did.
for
Yes.
3 shows. We did 3 back-to-back shows. It was wonderful. If you've never been to the Sphere, if you love music and you love performances, I highly recommend go see a show or two at the Sphere. It is like no other experience, and no matter what I say, it's still never going to define the experience. And no video will ever really show you the experience.
Yeah, it's something else.
It's immersive.
It's
Have you been?
I have, and it just
Yeah,
for a movie, and it's
yeah.
unreal. It's a must
It,
see.
it is unreal. I saw people falling over their seats because they were like, "Is this building moving? Like, what's happening?" Like, it was insane.
Well, thank you for what you do.
Yeah,
By the way, thank you for your service. I noticed you
yeah,
were a decade in the National Guard. Is
yeah.
that
I
right?
did. I did 8 years in reserves. I was a field artillery
That's
officer.
that's
Yeah. Thank you
extraordinary.
very much. Yeah, no, I appreciate that. Yeah.
I appreciate you. I appreciate all the insights you shared, and we will break bread here in Boston at some
Excellent.
point in the new
Yeah.
year, and I really look forward to that. And thanks for joining, and thanks everyone for listening, watching, sharing. As always, take care, Ed.
Thank you, Evan. Take care.
Bye bye. Bye bye.